I'm Dr. Tsai, and I work as an emergency medicine doctor in Mackay Memorial Hospital based in Taipei, Taiwan. I've been a doctor for more than 26 years already, and at this moment, I also serve as a director of international medical service and the chief officer of hospital affairs management department in my hospital. So I'm also a physician, but also an administrator, dual roles in my hospital. It is challenging, but I think it also opened a different door in my life to see the world in a different way, besides as a clinician. So that's why I had the opportunity to join the medical mission teams and come here with the team to Ukraine. So I think it is I would say it's a gift from the God, give me the opportunity to do this work. And it's a very meaningful work. And I'm so proud of myself and being really grateful for the opportunity. My hospital, Mackay Memorial Hospital, as you can tell, the name is actually not a Chinese name. So Mackay, he was a Canadian missionary who came to Taiwan year 1880. And he came here as medical missionary to help Taiwan when that time there was a big medical need. So he crossed an ocean and come to Taiwan and set up a dental clinic and started there. Then he settled down, he married a local girl and had a family. So his legacy of what he did really impact people like me who works in Mackay Memorial Hospital. So nowadays we just continue his legacy. We want to follow his footsteps, go where there's a need. So it's not just locally in Taiwan, but just like what he did, cross an ocean to somewhere there's really a big need. So we been doing international medical service for more than 30 years already. So this Ukrainian medical mission is just one of our international medical mission that currently we are doing it. And personally, I think this medical mission in Ukraine, it's a little bit different from what we've been doing for the past 30 years. Because one of the major key factor or thing is that we found a very genuine partners here, which is CMA. I think we have one thing in big common, that is that we are faith-based institution. And that really makes a lot of things different from other collaboration with many other institutions. Because we are institution, and so does CMA. We are not just to help the people. We want to help the community. We want to help the nations. And so we are patient-centered in principle. So it's a little bit different from a lot of things that we collaborate with other institutions. So I think that really makes this mission very special for us. When the work broke out back then, so we felt an urgency to involve. But the urgency to involve is not just being brave and say, let's go. It actually takes a lot of dedication and a lot of works and pay attention to detail, because we need to find someone that is really trustful and also good in local logistics. So we actually, I guess it's all under God's arrangement. We had opportunity through someone and had a connection and to meet with CMA. And the moment we had a connection, we start to talk online, and we realized that it's really a opportunity that we can work together, because we found that CMA has the very good ability, because it's a local genius institution, that you take good care of local site safety assessment, and also very good at the local logistics. And also it can help arranging some other, such as equipment and medication, everything that are very essential to make the international collaboration work really successful. This is, like I said, we have been working a lot of international missions, and some of them didn't turn out the way we wanted to, because we had very big, high goal and vision, but in practicality, the execution, sometimes those parts went wrong and didn't go the way that everyone wanted to, and the effort did not ends up with good outcome. So we are very happy and we are very grateful that we actually found a very genuine partner like CMA. We have already completed 6 missions, and currently we are doing the 7th. That's why I'm here at this moment. This is our 7th time to come here with our medical mission teams. I think the biggest challenges is about have faith and being confident, and also the way of facing the risk. So personally, I think the biggest challenge to me was during our 3rd trip. We were in Mykolaiv, and our hotel was attacked by Russian missiles in the early morning, 5 a.m. So the team members woke up middle of early morning. People, of course, they were panicked. They were scared. However, everybody was able to put everything together and respond the way that we trained everyone before we left Taiwan to come here, follow our standard operation SOP of evacuation. So everyone was able to, calm and orderly went downstairs to the shelter. And of course, we were very lucky, no casualty for our team. And in fact, our team at the shelter, we are the only team that came and showed up well prepared. I meant we were fully clothed. We had our, evacuation backpack with our document, our cell phone, our power bank, everything, and everybody wore shoes. Compared to other, hotel guests, everyone came because it was early morning. People woke up of sleep. People did not dress properly. Sometimes don't even have any dress, just covered by a blanket. So it was a moment that people realized that, yes, this is exactly what we are prepared for. I mean, it's really a big challenge for everyone, both mentally and physically. After the attack, one question I keep in my mind thinking is that this means an end of our medical mission here in Ukraine, because the attack is real, the danger is real, the risk is out there. It's not something far away, it's something that you would never anticipate, because it just happened anytime. What I was thinking is that maybe that could be the last trip that we came here as a medical mission. And I was telling myself to be prepared to face my team members and to talk about this, because I think this is something we need to talk about. And so I was fully prepared that to hear everyone say, yes, we are done. Yes, after this, yeah, we are not coming back as a medical mission team, but we may come back as, tourists or some other roles. But, the whole thing really surprised me is that every single members of the team told me, no, they want to come back. And that really surprised me. I think that's the one experience in my whole life I'll never, ever forget. It's because how this mission, the medical mission that we involve, really change. Why I'm saying that we come here to help, but we stay here to learn. Learn what? As a grown-up person, be more physically, mentally mature, be more prepared and know how to face our challenge and risk. We were talking about, yes, maybe we can just go and leave, so-called escape out of this chaos, but how about local people? Where they can go? They cannot go anywhere. But they stay calm, they face what happened. And yes, we have the options, but this is something we witness, the local people, their braveness, their persistence. And most importantly, the resilience that every time we come here, we see it, we stay, and we learn. So it's not just come here to give, but also, like I say, we came, we stay here also to learn. And that's very powerful impact, not just me, but also surprisingly, it has a very big impact to our team members. So everyone said yes, they want to come back on our fourth trip. And I wasn't really sure that if they were joking just to make me feel better as a team leader, or they are really, they really mean it. But no, everyone say they mean it because they know that what happened, it's really just a different form of challenge and risk we encounter on our life journey. You may have different form of a risk that you see or you meet or you encounter expectedly or unexpectedly. But most important that you can survive and become a better one is you are prepared. You are not led by your fear. You manage fear and know what exactly to continue to move on. So I was touched. I never saw in that deep level, but this is especially for the young age of team members. Sometimes you think, yeah, you grow up with wisdom because from your life experience, but like our young team members, doctors, they are in their 30s, and I have, I'm over 50s. So I thought, yes, 20 more years of life experience, really means something. But maybe in this part, maybe not that important. It's really your mindset. And like I say, every time we come here, we stay and we learn. And I saw that, and that was really powerful. There are so many volunteers from our hospital who want to join the team, but I would say only one-fifth means that 1 out of 5 can really finally made it, join the team. All the other 4, unfortunately, they have to make a compromise and being in peace with their family. So this, I think, is the challenge. Otherwise, I think we have a very, really mighty powerful partner like CMA. Like I say, you take care of the local, logistic. You do the site safety assessment. You arrange everything else to make the mission works. So really, I really have no other concern or worry, once we come here. Yeah, because like I say, we both are faith-based organization. So it's really the trust, not the MOU that we sign, just collaboration in paper. It's more than just the paper that we sign, that we have a formal, partnership. It's really the joint effort, that we do the same here. So I think it's really not just Mackay to come here. It's Mackay and CMA work together to help the community. I think overall, medical service-wise, we also had the opportunity to, I came up with a program to have 6 Ukrainian doctors to come to my hospital for clinical experience exchange. And the feedback from them were impressive and all very positive, because it opened their mind to see how efficient way that we do in terms of medical service management. In Taiwan, everyone has a healthcare insurance, but it's provided by the government. So it's a government-run healthcare program. As you know, if it's government business, a lot of time, it involves a lot of bureaucracy. But in order to make things work, each hospital, our administration and management have to come up with really good, efficient way to fight against the bureaucracy. So there are so many ways that physicians from Ukraine, they never thought of it, that, we could do this way to make, our service, in a very good standard, but also, save a lot of time. And that's the feedback that they gave us. It's way different from the experience they had in the United States. In the United States, most experience came from the other countries' physicians, including Taiwanese doctor, visit US. What they found is they have very good resources. They have the best, most advanced equipment. However, the protocol is really built on with, a lot of resource and make everything, really good. But back to Taiwan, in fact, I have to say, we probably are the similar situation, that because the healthcare program is run by the government, so the resources are limited. But we have to take so many people. And, government doesn't really care how you do. They just want you to deliver the result. So it's really our, responsibility that we have to come up with really good, creative way to do it. So we can make sure that patients don't stay in the hospital way too long. So we want to shorten the length of stay, but also make sure the result, like operation, the total knee replacement, things like that, can be done quickly, efficient, but with good quality. In Taiwan, if you go ahead with a total knee replacement, after surgery, you probably stay no more than 1 week. Then you are discharged from hospital and just come back to the clinic as an outpatient for follow-up. And I think, if I'm not wrong, the Ukrainian doctor found that very impressive. So I think the collaboration between Mackay Memorial Hospital and CNA, it really goes beyond the clinical services. Nowadays, for example, in fact, we also just did the academic publications in regard to our medical missions. So this is something that we want also in the academic, circle knows that, we have been doing things in helping out people, but also from academic perspective that we can share the experience to know that this is something that people can learn from it, should be aware of it, or maybe in the future come up with something more interesting or more good in terms of providing a service to not just Ukraine, but everywhere else has the similar background. And also, you also mentioned that now, because our continuing collaboration, it also, draw the attention of the Lviv city government. So we are actually invited as a, technical consultant in terms of helping out building the medical information system of the new hospital in Lviv. So I think this really kind of expand the scope of what we can do and work together. And this is only because, like I said, we are faith-based institution, that we go beyond not just clinical services, is that we want to work together to help the community, to help the nation, That's the, I think, the really beauty and the special part of our partnership. So this mission, again, we collaborate with local doctor teams and with local medical students. We have a mobile clinic. We going to visit 3 different, town and the villages and provide the service to those underserved because the war. And myself, I leading the education team. So I'm going to Malaysia, and we collaborate with the National Pedagogue Medical University, where I will give the American Heart Association, certified, ACLS course. And that course this will be my 3rd time to come here to deliver the course. And it's very popular and it was well demanded. And people saying, wow, ACLS is nothing special because in fact it's an advanced technique that a lot of professionals involved in critical cares are required. But the course I deliver, which is a HA, certified course, one of the special thing about this course is that it involves the concept of teamwork, which that the feedback I receive is that Ukrainian doctors think that's very, useful and practical, that they didn't have chance to learn or to be aware, or most importantly, how to implement, to use this concept. And during this course, because it's a practical-based course, what I mean is we give a case, we do the simulation. So I coach the Ukrainian doctor how to use this concept and involve and use in the scenario. And they found it that very useful and very, it's very beneficial. So the course become really popular. A lot of people, they want to, join the course, and they heard the concept, but knowing one thing and doing is 2 different things. People, they know, but they cannot do. So they want to join the course and they want to learn how to do it. And I'm very grateful that we are able to provide a course that really meet the local needs. And that's another unique thing that I think we are very happy to work with CMA, is that we always discuss what exactly is the most beneficial thing that we can deliver here to meet the local need, rather than come here, bring something that we are good at, but it may not necessarily to be the most needed thing here in local communities. In fact, for the past 2 years, since I took over the Office of International Medical Service, the Ukrainian mission actually gave me a very good lesson experience that I can also share in some other countries' medical mission. So this is another beauty. Like I say, we come here not just to give. We stay here to learn as well. And I can, duplicate the model in other countries, projects. Yes, we do the training course. We train the C instructors, actually even more advanced way. We train the C instructors that we hope the physician can be the teacher as well. So after they finish the instructor course, they can here teach their own fellows, rather than waiting for us to come each time to join the course. Yes. I would like to say to the local Ukrainian doctors and medical students, I think you should be really proud of who you are and the profession that you are holding on to. Because I think the experience I have working with you guys, doctors and medical students, it was very impressive, because your persistence, your knowledge, and the dedication are really way above the average level. And I think that's your advantage, and I think it's something unique that we've been working in many different countries, that we don't see that consistently. But here, every time we came, we always see the constant level of dedication. So I think I would like to say that in the period like this, during the wartime, I think you guys should be use the opportunity to devote it more if you can, not just personally for your personal career, professional development, but also I think it's a way of personal life journey achievement. In a look back, in 5 years, in 10 years, or in 20 years, I think you will have a very satisfactory, mindset and confident, and also happy that you had a very good choice doing at one point involve a work like this that make yourself really proud, make your country really proud, and make us as partner also very proud as well. For other international partners, I would say that personally, sometimes it's not how much you can do. So never underestimate your own power and your capacity. And just be, genius. So it's not how big you can do. It's that if you feel like you have the capacity and you are willing to, don't hesitate to, move the first step. Contact CMA. And like I say, CMA is a genuine and a mighty NGO institution. They are, in plain English, down to earth, honest, and can, discuss and find the best way that both can work together to help out the heal the community, and also, being, help the partner to reach the satisfaction of giving, and offering the initiative. So we are very happy. Really, it's really, in a local ancient saying in Taiwan, I must do something good on my previous life. That's why we have this arrangement to meet CMA and to have the opportunity to collaborate. So I think just give a try, and I think you would not just give, but also in return, I think this would be a lot of things that you never thought of, but you will be very grateful, at the end of each, mission or collaboration project. In Taiwan, the old mentality is that no, if we are doing something in good deeds, good thing, you shouldn't talk about it, But nowadays, I don't think that's good way. I truly believe, if we are doing something good, we have to use this as a positive influence to our surrounding, to the community. It's not to show off how good I am as a person or as an institution. It is that we want the society to know, yes, they are good people. We are good people with good idea, initiative. Want our society to be better. Because if we don't do that, our society will be full of a lot of bad news. Bad news. Because that bad news is easily to catch people's attention. So the media won't just fill with fake news, with the bad news, or with the news that we really don't know what's the point of the news. And we need to, give those good things, good news, a really better roles. So I personally am I'm an advocate, of, spreading the good news, especially like the thing that we do is really for good initiative with good deed, and why not? And hopefully more people like us, same, mind, like people, community, institution, can join us and do more.